Good evening. Good evening, ladies.
Good evening.
Good evening.
I'm very pleased that Rhoda Schuling from the Netherlands is joining us. She'll be a treasured guest at our conference in November on compassion, mindfulness, and body memory in healing. And I'll give the floor to you, Rhoda, and I'll ask you for a short introduction for our audience.
Thank you, Marketa. Yes, my name is Rhoda, and I have quite an eclectic career, but in part of my career, I did a PhD on compassion. This was a follow-up course to mindfulness-based cognitive therapy in a group of recurrently depressed patients. And I did this PhD. I finished it in 2021. And this has since gone on to the rest of my research career. Of course, I'm still a researcher at the Hanze University in the Netherlands. And I'm also a mindfulness teacher and a compassion teacher and a teacher trainer as well. I train people in the Netherlands to be compassion teachers. And of course, I entertain a daily practice for myself as well.
Thank you for this wonderful introduction. And since you focused in your studies, in your doctoral thesis, on the effectiveness of mindfulness and compassion in recurring depression, and since depression is a big resonating topic in our society, I would like to ask you, what did you find out? What was the result of your research on compassion and its effectiveness in recurring depression?
Yes. Well, first of all, maybe it's good to say that in general, it seems that for recurrent depression and sequential treatments are more effective than singular treatments. So we would say just medication or just mindfulness or just cognitive-based therapy. Cognitive behavior therapy, I meant. These are all effective, but in general, we see more effective these are combined. The thing that hasn't been combined a lot yet is two psycho-interventions following each other. So we thought it might be good, given the effectiveness that we already had on mindfulness-based cognitive therapy for recurrent depression, to follow up that intervention with a compassion-based intervention. And this is called mindfulness-based compassionate living. It was developed in the Netherlands by a psychiatric nurse who also studied as a Buddhist monk, and a psychiatrist, Erik and Fritz. And what we found when we conducted our study, so we did a large trial. We had people, we sent people letters of invitation to the trial if they were recurrently depressed and if they had followed an MBCT in the past, so that we knew for sure that it was going to be a sequential treatment. And then we offered them the treatment, we offered them the intervention. And what we found that part of our group was actually depressed at the moment of doing mindfulness-based compassionate living. Part wasn't. Part wasn't depressed. And we found that depressive symptoms significantly reduced after mindfulness-based compassionate living, which of course was a wonderful result. This is what we had hoped for. And we also found, which is a little less common, that after 6 months, people were still reaping the benefits of the compassion training. So usually after such an intervention, when there's no more guidance and people are, left to fend for themselves once again, the results sort of go down and they sort of, slip back into depression. They have to really maintain it. But with this intervention, we noticed that people 6 months later actually still had higher levels of, lower levels of depression, I must say, they didn't have. So they still had I don't know what we would call that, a happiness level, a happiness level that was improved. And we were really happy with those results because they indicate that compassion, when it is learned as a skill, is maybe something that stays with people and they're able to really practice on their own. We also conducted a qualitative study, so we did interviews with part of the population that we researched. And these people indicated that in fact, the compassion training works somewhat different from the mindfulness therapy that they had. So with mindfulness, they said we were really able to, notice how we felt, recognized the feeling, sort of stay with it, but then it would stop, and they would say like, yeah, it feels like there should be a second part, like something that I want to do with how I feel because it's not pleasant how I'm feeling. And that compassion really gave them the tools to actually work with the unpleasant feelings. And this in turn, if I may continue, this in turn led them to really expose themselves to very difficult feelings, sometimes trauma from the past, sometimes more recent experiences, because they felt more warmth and safety. So they were actually able to make themselves feel safe, which allowed for more exposure to the difficult feelings. And then they got trust from that and confidence. And then they could handle even more difficult feelings. So they really felt like it was a gradual opening up, a gradual exposure to all the pain from the past.
Mm-hmm. Speaking about all that, can you give us one short example of a compassion technique that people in your study were submitted to?
Well, some of the exercises or practices in the compassion training are quite similar to exercises that we already know from mindfulness training, but one that is a little bit different. So the compassion training makes more use of the imagination of people. So they make more use in practice of people's ability to imagine being safe or imagine being with a safe person. So one of the practices is called being with a compassionate companion, and people are really gradually guided through, imagining there is a being or a creature with them that embodies compassion.
Mm-hmm.
This can be something that we already know from the metta practice. This may be an actual person that they associate with compassion, someone in their own lives, but we usually invite them to take someone that they don't know and that they don't have a personal connection to, or to even take an imaginary creature or an animal even. So for instance, when I do this practice, very often a horse pops up. I love horses. And I have this horse that sort of looks over my shoulder. And sometimes at other conferences, I have joked that you could take E.T., for example, with his warm heart and the finger that glows up. Whatever person that sort of resonates with you and embodies qualities of compassion for you, the quality of wisdom, maybe a slight sense of humor, that they can sort of, look at you with a very benign, well-willing energy. So we invite them to imagine this. And then, of course, after practicing with this, you could take this image of this compassionate companion with you throughout the day, so that when you are in a difficult conversation with your boss, or you're just stubbing your toe or something, and something that's is with you and is wishing you well and is comforting you.
Mm-hmm. Thank you. That was a wonderful example, a horse or an ET. Now,
and I'm wondering that it resonates, like creating some safe space within the person where
Yes.
they can be with that emotions or difficult feelings, let's say. And I'm curious. You talk about intervention. What does it mean? They were on one session, or they went like through whole week retreat, or some long-lasting therapies?
Yeah, this compassion training, the mindfulness-based compassionate living, was really designed as a follow-up to MBSR or MBCT, and therefore it has a very similar format to not confuse people with radically new forms of teaching. So it's also an 8-week program, and each week there are sessions of about 2.5 hours, and these are filled with practice, with some psychoeducation on our stress system, on our emotion regulation systems, and also, of course, some inquiry with the group, just like in the mindfulness-based programs. It's up to the teacher, of course, if there is enough time, but we highly recommend also doing a silent day or a silent afternoon or evening to really, practice more in more length of time, somewhere between session 6 and 7.
Yeah, it's wonderful. So 8 weeks, and a person can feel better.
Yeah, they can, and of course it remains. It's a practice of a lifetime. Of course, we're talking about recurrently depressed people here, but I often say that most of us in the Western world, I think, could really benefit from doing compassion practice, because we are often trained and educated to be so hard on ourselves. We are our own worst critic. There's a specific session on the inner critic versus your inner friend, like your compassionate companion, for instance. Because, very often, instead of someone who sort of gently guides us along, we have this drill instructor shouting at us in our minds what we're doing wrong, and we're evaluating everything we do from day to day, and more often than not, we turn out to not be enough.
Yeah, precisely. This whole system, this whole society and culture has been designed over the centuries to basically kill the competence, the capacity of self-compassion, which is innate to us. It is being suppressed right from the onset, right from when we are born. So no wonder there are the general state of the general health state of us is in such a poor way.
Yes.
And speaking about that, do you see a connection between the occurrence of depression and childhood trauma?
Yes, I do very much, and that's it's evident in the specific group that I researched. So we had 122 people in our study, and at least half of them had suffered childhood trauma. We measured that using a questionnaire, but we also know from the literature that depression is highly linked to childhood trauma. We also looked into that, whether, for instance, an earlier age of onset of the first depressive episode was linked to any of the outcomes. It turned out it wasn't, but perhaps it was a bit difficult to differentiate, because so many people had the childhood trauma. And then also in general, in the population today, in the Netherlands, for example, we see that age of onset is getting younger and younger, and it's dropped to 14 now in the Netherlands. So this is, of course, a very young age.
Yeah. If I may self-disclose, which we are taught by Dr. Gabor Mate, of whom both of us are students, my depression first occurred when I was 23. But nowadays, we see 17, 15, 14 years old kids that are already that they have suicidal ideations and see no purpose in life and all that.
Yeah, and it's of course it's very difficult to speculate, or at least I'm not an expert on all of the causes. But I think in general, it's a bad combination to have a society that puts a lot of pressure on young people, linked with our social media devices that really take us out of the moment all the time. So we have a lot of pressure on the one hand, and on the other hand, very little opportunity to practice being with ourselves just as we are. Also during the very difficult emotions. So I think we are, and this may be a little bit outspoken. I don't have any evidence to support it, but it seems like we're raising a generation with very little tolerance for experiencing difficult feelings.
Indeed. Yeah. By the way, speaking about teenagers who suffer from depressive symptoms, do you have any opinion whatsoever on medication and classical antidepressants in such young ages?
Well, it's difficult for me to say because I'm not an expert on medication. I do know that the literature shows that interventions like this, the mindfulness-based programs, they really show a similar effect. So they have a similar percentage of effectiveness to antidepressant medication. And for me, with all the side effects that antidepressant medication also has to offer, apart from being effective, I would rather that they were the second option, and that we sort of tried other avenues first, especially when these are proven as well. So, and in that, I'm thinking about certainly mindfulness-based programs, but I'm also thinking about exercise, and I'm also thinking about nutrition. So I think these three avenues it would be good if we just explored these first with our individual patients. With the MBIs in particular, maybe because these are group interventions. And of course, we see that a lot of young people feeling lonely, and they feel embarrassed in front of their peers, and they're, it would be good to do these things in a group setting and to become safe with each other in a group. Having said that, I think there are certainly cases where antidepressant medication is the best course of action.
Yeah, and I'm wondering, do you see, if you work with teenagers, do you see some kind of faster recovery from depression than adults? I'm speaking regarding the brain development, the neuroplasticity is maybe more active than in adulthood. So do you see such a difference or not?
I don't work with teenagers specifically, but we did see in our study that a younger age was predictive of a higher effectiveness. So the younger someone was in our population, chances were they would do better with the mindfulness-based compassionate living program. We did see that. I work at a university. I'm still a senior researcher, but I also teach. And from that experience, when I teach students, I did a study last year with students. So they're not exactly teenagers, but of course they are very young. We gave them the choice in what kind of intervention they would like to do for their own well-being. These were students that suffered from ill-being, you might say. And a lot of them chose mindfulness-based programs. And they reported back that just the ability to pause for just a little while, to just pause and know how to do that without looking at your phone. Some of them described that, they're constantly under input. They're under input from the phone, then they're under input from the class, then they're under input from, their friends, and then they're under input of the phone again. So there's this constant stimuli bombarding them, apart from when they're sleeping. So a couple of these students really reported that, they really didn't know the experience of not having stimuli and really pausing.
Yeah. I was thinking that when you were saying that previously, that we are so disturbed by all the things that we don't have the time for pausing, and maybe what is lacking there with all the cell phones and growing generation of maybe say like low resilient people. It might be that we are losing this presence, this moment of being here and now.
And I think when we miss that, of course, a lot of us here in the West anyway, we're still treating our body as this vessel that carries around the more important part, our mind. And when we're never in the body, we miss all its signals about what is happening and how we are. And of course, very often we're not that well and we need some time to recover, or we need some comfort or whatever, and we just miss all these signals. And I think, we all, you probably all know the work from Bessel van der Kolk, the body keeps the score. At some point it's gonna rear its head and say, well, if you don't pay attention, I'll make you pay attention.
Yeah, definitely. As also Gabor said, that the trauma leads to disconnection from the body, and all this overwhelmed stress leads to shut down the signals, because we can't every minute think that, oh, I'm hurting, or like this is not possible to handle. So from my experience, I barely felt that I'm thirsty and hungry in my work. So it leads into all that consequences, that this is this shows for me like the mechanism of depression, or the sources are like, there are multiple sources for that it's not genetic, like strict genetic condition, we know that, and there are multiple things which influence that. And I'm curious about your opinion about other techniques which may improve the state for people who suffer.
I think one of the most important things is what we've already been discussing a little bit, is the ability to really go through our experiences. So it has become my opinion that a condition like depression is basically an avoidance disorder. You're avoiding exposure to the difficult feelings, to things, and sometimes it's not even difficult, it's just a little bit blah, when we're bored, we're even avoiding that. That's already very unpleasant. It's very mildly unpleasant, but we tend to avoid that one the most, I think, just being a little bit bored. So really getting to know that feeling, and but really just tolerating it. Okay, I'm a human being, I'm bound to get bored at some point, that's what we do, so might as well just go through it and not have to find solutions to it, because it's a very natural state to be bored. So to not have to chase all these solutions, that would bring a lot of peace and quiet, I think, that we didn't have to solve being bored. So that's one thing. And of course, a part of that is recognizing that there's nothing wrong with us when we feel pain, that it's just, to be alive is to suffer, at least to some extent. And even the very, very lucky among us will suffer. So it's just a part of life. And the only state in which you don't suffer is when you're not alive. So in a way, it's a good news. It means you're alive. But and I think the other thing that is really characteristic of depression is that it feels very stuck. It feels very narrow, and it feels very solid and unmoving. So I think mindfulness is really great in helping us experience that experience in itself is actually not solid, that it moves, that, you know, things come together in a certain experience and they fall apart again, and then they come together again, and it's just a flow. It's always moving experience. So that's one part. But then, you know, you might take that very literally, which we did in one study in which we were offering mindful walking, that if you feel that your mood or your state of being is very stuck and very solid, then just go out and literally move yourself, move your brain, move your heart, and go out and see space instead of narrow. Just go out, go somewhere where there's an open field or a beautiful view, or just literally move and literally see the room around you to get your mood out of feeling stuck and narrow.
Mm-hmm. Yeah. Yes. And do you have any comments about like physical activity during treating depression?
Well, I always have to be very careful to only say things that I've actually researched. And if it's just my opinion, I will very clearly state that it's just my opinion. Well, we researched the walking. We did a program in which we offered people hiking along a river in the Netherlands. They didn't have any map or anything. They just had to follow the river, and they could do this for 1 day, 3 days, 6 days, or 10 days. And the 1 and the 3 days were with a group, and the 6 and the 10 days you would do individually. And in all cases, you could have a mindfulness teacher on call, and you could do practices in between, or call them and ask for guidance or anything like that. And the people in that study said that in as little as 3 days of hiking, they already felt like their inner landscape becoming more fluid, just like the outer landscape, just like the river they were walking past. The sort of the cadence of the walking, the legs just sort of going like step 1, step 2, step 1, step 2, that just sort of put them in motion and really lifted some of the heaviness of their mood. And it coupled with the view, like the nature helped, seeing the nature, knowing that in nature things come up and they die. They are part of the seasons. So it just sort of really helped them make the troubles at home not be there, but to sort of identify a little bit less with all of that and just be moving. So I think in general, things like walking, especially outside, especially in a natural environment, is very helpful. There are also very specific yoga and qigong exercises aimed at people with depression. I'm aware that yoga emphasizes postures where your head is hanging, where the head is low, or when you're upside down. These especially I've read, I've not researched it, but are helpful with depression. And of course, everything that sort of shakes you out of your mood a little bit. Sometimes you just want to tell people, I mean, look at a dog when he gets out of the water and then he sort of shakes his entire body to get all the water off. Like when you're in a mood like that, do that. Sort of shake yourself out of the mood. In my experience, it helps. That's my personal experience. Yeah.
Yeah, I can only confirm that. Walk or a very gentle run, jog in the nature, in the woods, in the park. That's a game changer. And then a cold shower or a hot shower, cold shower with some aromatic essential oils that can really change the mood in a dramatic way. Not that it can replace a regular therapy and treatment, but it's a great addition to the whole treatment. That like when I admit that I'm depressed, I have to realize that I really have to change my life and give myself a proper treatment. But that walk and run and shower and smell and music and dance, that can do a lot. Yeah.
Yeah.
And I have to admit, your program sounds really brilliant. And I've been wondering, listening to you, have you been thinking of expanding your program into other countries, or have you already expanded it?
Yes, it's already been expanded. We have mainly Fritz and Eric, the men who founded the course. They also have an international website, and they have visited many countries already to teach people how to be compassion teachers. And these people are all working as teachers. And the program, our teacher training program, is also very much geared to people who work with people and don't necessarily want to become a compassion teacher, but do want to incorporate elements from this program into their lives. So these are, psychologists or nurses or social workers, even educators, all these kinds of people who just work with people, and who wish to incorporate these elements. And I think, I'm not sure in how many countries, but in a lot of countries, certainly in North America, South America, most of the European countries, Australia, Asia, Eric and Fritz have taught people how to be compassion teachers or how to work with compassion.
Wonderful.
Excellent. And now you are coming to the Czech Republic, to Prague.
Yes, exactly. We're very much looking forward to it. Yeah.
And so are we. Well,
great.
Yeah. Maybe one question pop up in my head. Maybe some personal opinion, or like, what is a compassion for you? What does it mean for you?
Well, then I also have to get personal. I think I was just today, actually, I was doing a little bit of yin yoga, which I think pairs really well with compassion. It's a really good combination. We might have to make a hybrid program some point. It's really just this ability to be with your own suffering, and to really allow it to be what it is in this moment. And of course, it's sometimes really difficult to explain when you talk about acceptance. It's because it's not accepting that things are as they are. It's not accepting, well, I just have to accept things. I just have to think they're okay. I just have to go along with things. That's not compassion at all. We often compare that to Gandhi. He was a very compassionate man, but certainly not a passive man, not someone who thought everything was just okay. He came into action, and sometimes we refer to that as yang compassion, and we also have yin compassion, which is softer. But for me, I've always been really drawn to the yin compassion, and yeah, to really accept a low feeling in this moment as an experience, and to and all that entails that I'm okay when I feel it. I'm okay to have it. I'm okay to experience it. I'm also okay when I deny it or when I want distraction from it. But it is most helpful to just embrace it as part of life, part of me.
Mm.
Like
This
it,
is,
sorry.
go ahead, Bietka.
Yeah, like it brings that reality check. Like I can deny it for now, but I know that it's not the way it works. Like,
No.
but I can face the reality. Yeah.
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 Usually it's fine if you make a conscious decision, okay, I'm not gonna go there right now. But in the program there are a few very short exercises that are very similar to the mindful breathing space, where you can say, oh, this is a moment of suffering, this is really painful. Yeah, okay, this is how it feels, it's fine, everybody suffers. I'm not going to go there now, but I'm going to revisit this tonight when I have more time or when I'm by myself. But I do acknowledge that this is a moment of suffering.
Mm-hmm. Mm-hmm. Yeah, because the person also needs to feel when it's overwhelming or not. Yeah,
Yeah.
like the acknowledge that the boundary, like I am not able to go there yet now.
Yeah.
Mm.
Yeah, exactly. And I think that's a very important point that you address now, because so much of this work is about the intention. So it's and also with the example that I gave of the compassionate companion, if you cannot think of any creature, if you cannot imagine anyone looking at you with compassionate eyes, then perhaps it's possible to wish that you maybe someday can.
Mm.
And to make it smaller. And that's already a wish of willingness, of warmth toward yourself. I can't imagine it, but I do wish that I could.
Mm-hmm. Mm-hmm. So these small steps on a
Yes.
ladder, like
Yeah, and especially for this population, for recurrently depressed people, it starts with the very, very small. Yeah.
Right. Well, ladies, do you have any more questions or remarks or anything wise and compassionate to wrap up our chatting here?
I maybe would ask Rhoda one last question, I promise.
Mhm.
Then, because it's for our audience, for people who may attend our conference and maybe who are sitting at home, a little bit depressed or in some kind of stress, what they can do. Do you have any like advices what to do on your own at home when it comes, or how to help yourself?
Yeah, I think this is pretty scary territory for a lot of people who are recurrently depressed. Very often they have associations with good feelings being bad from the past. Like they've learned to be suspicious of good feelings, because usually right after the good feeling, something really bad happened. So it can feel very, very unsafe. So I think the most important thing is to, if you practice on your own without a teacher or a therapist, to really, really go very, very easy and gentle on yourself, and and perhaps only to acknowledge that this is very scary for you.
Mm-hmm.
You may recognize your heart wanting to go in that direction, and at the same time there may be something saying, whoa,
Mm-hmm.
hold on, that's not possible yet. So just to really acknowledge that, and that you may take really great care of yourself.
Yeah, you mean like keeping yourself fat and hydrated and in a warm place. Yeah.
Exactly. And Marketa just gave some examples of things you may do. Allow yourself to soothe yourself. You know, go for that walk, take that hot shower, make a hot cup of tea, stroke your cat. I love stroking my cat. It really calms me down. You know, do a few stretches. You don't have to do a whole yoga session. Just hang your head upside down for a few minutes and go on. Just little things.
Mm-hmm.
Yeah, I like that. Little things. Yeah. And allow myself to soothe myself.
Mm-hmm.
Yes. You are allowed to take care of yourself.
Yeah.
And if I may, what I also really find quite helpful is to eventually allowing myself, I mean, I had spent many years not talking about my depression and suppressing it, being ashamed of it. And in the recent years, I figured how relieving it is just make a phone call and just tell to someone, I'm feeling like shit. I need to cry. And just cry and have that compassionate friend or family member, if possible, who will just listen to your cries and accept it as it is okay.
Yes.
Yeah. And I totally understand that it is not accessible to everyone for many reasons.
No, so it even when you don't have that, or it's not accessible at the moment, it helps to sometimes really voice it for yourself, to say it out loud as if there is someone else, to sort of let some of the pressure out. But of course, you're very right. It's a very isolating condition, being depressed. And if there's just anyone that you know that you could call and just say, like, I'm there again, you know the one, and who won't judge you and who won't give advice. Yeah, that's of course great.
Right. Well, Rhoda, thank you very much for accepting our invitation for this interview, for accepting our invitation to come to Prague to the conference. And I am already so much looking forward to your and Marlene's lecture and workshop. So I'd like to invite all everybody who is watching the interview to a conference on compassion, mindfulness, and body memory in healing in Prague, in Prague's Congress Center on November 8th and 9th, in less than a month. Please come. It'll be worth it.
Yeah, so thank you very much, Rhoda. Thank you, Marketa, for
You're very welcome. Yes.
Such a nice interview, and
okay.
Very nice
see you
talking.
soon.
So see you in Prague in less than a month.
See you in Prague.
See you.
Okay, bye-bye.
Bye.
Bye.